Hello and welcome. This is Joe Valenzuela with Vista Mutual Insurance Services, trying to bring you all of the news, tips, and tricks for Medicare insurance for clients and agents. Today, we're going to talk about the Medicare Drug Negotiation Program. This is a new program that has just come out from Medicare, and it is one of the first times that they're going to be able to negotiate the drug prices. So this is going to be a very, very big win for Medicare clients and a lot of our clients as well. The reason the program was initiated was because if you're into Medicare insurance at all and you have expensive brand name medications, this can be your highest expense on these types of coverages. You know, some medications can retail for $20,000, $30,000 per fill. And the way that Medicare works is they have initial coverage limits and a coverage gap. So once you get to a certain point of retail cost, you're paying a large percentage, or 25% of the total cost of the medication. So it can be very expensive. Now, this doesn't really affect people that have just low-costing generic medications like blood pressure and, cholesterol stuff. This is usually very inexpensive and has a generic form. So this is really to grab those really high-costing medications that are doing well clinically for people and what they're treating and bring them down to a reasonable level. So we're really excited about this because it's one of the first times that Medicare or the U.S. in general has been able to negotiate drug prices. So it's really kind of forward thinking, and it's going to help so many people. Now, this was all brought about by the Inflation Reduction Act, and it led to the creation of the Medicare Drug Price Negotiation Program. Now, they are going to select a certain number of medications for this program to start off with. It's about 50 Part D drugs based on their expenditures in Medicare. And these are really common medications. They're going to break it down based on the clinical benefit of the medication, the price, alternatives available, if there's generics available, the research and development costs, and patient protections. They want this to be a very transparent procedure so that everyone sees what they're looking at, what they're negotiating, and what the drug company says, and then what Medicare says. They're going to include public input in this transparency. There's already been over 750 comments created for this, and it's publicly available. You can go on the website and you can create a comment, and I encourage you to do so if these things are affecting you personally. They love to hear from people that are actually being affected by this. The reason for this is to get everything to a reasonable level. And in order for that to happen, the drug companies have to participate in the negotiation and understand where the public and the insurance companies are coming from. Now, in order for us to make sure that they're doing that, if they refuse to comply with this negotiation process, they can get a potential 95% excise tax or a complete withdrawal from their drugs from the Medicare markets. So it's incredibly huge penalties if they choose not to go through this process or say, we don't want to go negotiate on that particular medication. So this was really good that was put in there, some really high fines and some potential of them to be taken completely out of the Medicare system if they're not going to be on board with this. Well, when they initially responded, the pharmaceutical industry, it was in a very negative way. I mean, you could obviously see that. They make a lot of money from these medications, and we're talking about negotiating the price for them. So there was a lot of backlash, including a couple lawsuits that 2 drug manufacturers and 2 industry groups filed. Now, the lawsuits that they filed, they indicate that they could be harming innovation and patients' access to new medications, and claimed violations of the First, Fifth, and Eighth Amendments. So that will have to get worked out in court, but as it stands right now, this is going to continue to go through. Now, if the lawsuits are found to be valid, then there could be some changes to these programs, but it's going to be very hard for them to prove those things. And they've always kind of leaned up against that, that if we get less money, then we can develop less medications and innovation will be. They make billions upon billions of dollars. Even if they were cut by 50%, they could still do a lot of research and development and create new medications. So that to me is just kind of a bogus argument. Now, what this is going to mean for clients is they're going to enjoy some reduced medication costs if this all goes through on these particular 50 medications. Now, if this works well, then they'll branch it out to all medications that are underneath Medicare. Now, it could potentially affect the availability of some medications. Because like we just previously discussed, if they decide that they're not going to negotiate, then Medicare could pull that medication from the Medicare system. Now, there'll always be things like exceptions that can still be done for individuals. This just means off the formulary itself, which is the list of covered medications, that it would be pulled. So don't worry if your medication is, work with your insurance agent, or if you work with us, call us and we will help you create an exception for that medication for your individual plan. Now, the transparency is incredibly important during these hearings because we need to know exactly what the drug manufacturers are spending to manufacture, research, and develop and make sure these drugs are safe. And we need to tell them exactly how it's impacting our clients, and clients need to tell them exactly how it's impacting them too. So this needs to be transparent on both sides, so we're happy that that was put into this. The best way to stay up to date on these things is to subscribe to our newsletter. Reach out to us if you're currently with us. If you're not, reach out to us and get this information. We want to have constant communication with you in order that you don't get trapped or stuck not having one of your medications because of something that went wrong in the negotiations. So we want to be here for you. We want to have these constant open lines of communication so that you feel very comfortable and safe about what's going to happen. And hopefully what's going to happen is just all of these medications are going to get reduced based on this negotiation. As an agent, you have to stay informed about all of these things so that you can accurately give this information to your clients and know what's happening to them. If you're not up to date on this stuff and you don't know this is coming down the pipe and somebody's getting their drug taken off a formulary completely, usually you're going to get some communications from other places, but it's always best to be ahead of this. If you know it before they do, you're going to provide them value as their agent. So in conclusion, we really want to look at this as a whole, and the Medicare drug price negotiation program is going to hopefully benefit a lot of Medicare recipients. With them having penalties if they don't do this, or possibly their medication being taken out of the Medicare system, with the transparency that's happening, that they have to open their books and we have to show them what we're doing and what we're paying, it's going to hopefully create this really good open communication. Here's what we pay for the medication. Here's what it's manufactured. Here's what we think will go against research and development. And here's what we can do to help the public. It's going to be a fight. It's not going to be something that's simple or easy, but stay positive about it. This was brought about to make sure that Medicare recipients don't have to pay this exorbitant fee for medications that they need to survive. And we need to keep that in mind when we're thinking about and talking about all this stuff. You know, there's money involved, but it's people before paper, right? These are actual human beings that we're talking about that could potentially have a loss of life based on not using some of these medications. So it's a very serious topic, and everyone on each side is taking it very seriously. And I think that this will lead to a beneficial outcome for most Medicare recipients. We want you to like and comment on this video. We will answer all comments that come in. If you have questions, please ask the questions as well. We will answer all the questions. If you subscribe, then you'll get the ding when these videos come out and you'll always be up to date. So for Vista Mutual Insurance Services, this is Joe Valenzuela. Until next time.